Kia ora katoa. Good evening, everyone. I'm Anne-Marie Morris. I'm a Plunket clinical leader and I'm with PlunketLine. And tonight I'm thrilled to have Bernadette Heafy. Bernadette, you'd like to introduce yourself?
Okay. Kia ora koutou. I'm Bernadette Heafy. I'm the Regional Immunisation Advisor with IMAC. I'm a registered nurse by background and I work particularly in the specialty around immunisation. And thank you very much for having me.
Well, we're thrilled to have you. Only, how long was it? The beginning of April?
Time's flown.
So much has happened since then. Bernadette did a Facebook live chat with us on with the Canterbury measles outbreak. We answered a lot of questions that night, and so tonight we want to answer a lot more of your questions around immunising our tamariki.
And it's a good chance also to remember and I guess celebrate that it's Immunisation Week. It's an opportunity for New Zealand and the rest of the world to promote and encourage immunisation. And the theme in New Zealand is protected together. Yeah.
So, let's make some decisions around, informed decisions. Let's get the information and decide what we're going to do for ourselves and our whānau, but knowing that we've made the right decision for us based on accurate information.
Absolutely.
Yeah.
Yes.
So, Bernadette, lots of people ring and they'll, or they talk to us as Plunket nurses and say, why should I immunise?
Okay, well, I guess the bottom line is immunisation is one of the best ways to prevent disease, to protect our tamariki and to protect our whānau. Every day our bodies fight all sorts of infections using our inbuilt immune response. By vaccinating, we take advantage of that immune system and build immunity and protection against disease without getting sick, which is the risk if you pick up a virus or a bacteria naturally, is that you run the risk of becoming unwell.
And we know how concerned everyone has been around the recent measles outbreaks that have been in Canterbury and now further up in Auckland, particularly, and how many calls the Immuniline has had, and PlunketLine and Healthline, everybody. So, tell us, why does my baby need the immunisations? And at the ages they get it, when they're so little.
Yeah, that is true.
Yeah.
But I think one of the most amazing things is that babies are essentially born with a fully functioning immune system.
Yeah.
Their biggest deficit is naivety. So they've not been exposed to anything. So they haven't had the opportunity to produce their own protection, or what we consider active immunity. Hopefully for most babies, during pregnancy, their mum has given them some antibodies, and we increase that by giving the pertussis or whooping cough vaccine and also influenza vaccine during pregnancy. So it sort of gives baby its first start, but that's passive protection. So mum's given it to them, they don't get to keep it. So we build on that by baby having their own vaccines. And baby's vaccination schedule starts at 6 weeks. And then we're 3 months and 5 months, and then on to 15 months. And on time does provide the best protection for them.
Yeah, it is really important that they're done on time, isn't it?
It is really important, but we can always catch kids up at any time as well.
Better to catch up than not at all.
Absolutely.
Yeah.
Yes.
Okay.
Yes.
So, who's recommending immunisation? Where's the evidence?
So the evidence is heavily weighted in science and in medicine. Immunisation is supported by the World Health Organisation, by places like the New Zealand Ministry of Health, the American CDC, the Department of Health in the UK. Essentially any sort of medical or national health program support immunisation. Plunket supports immunisation.
Yeah, Plunket does support immunisation. Yeah. So, so we've talked about it starting at 6 weeks. We know that babies get sick at any time, they can catch disease at any time. So what's the best way that we can protect them? So we're talking about immunisation tonight, and that's the
number one.
Number one way we can protect them. We can protect them, as you said, by mothers who, while they've made baby, they provide some passive immunity to baby. But what about all the adults that are around baby, once baby's born and out into the world they come, and then there's all these adults out there who may or may not be immunised?
Yes, that is very true.
Yeah.
So, certainly alongside baby being vaccinated, mum having her vaccines during pregnancy, dad, aunties, uncles, grandparents, thinking about things like influenza vaccine and pertussis or whooping cough containing vaccine.
And they're especially at this time of year too. For all the time, but
Yeah.
We're coming into the season for flu and,
Yes, very
and
definitely.
coughs and colds, and some of those coughs that people think are just a cough turn out to be something really quite nasty.
Yeah.
We can carry whooping cough as an adult if we don't have immunisation status, don't we?
You can, but it's more, the risk is if you're actually actively coughing and you've got whooping cough and you're likely to pass it on. I think one of the challenges with us as adults is if we get a cough and we feel generally okay, and with whooping cough you tend to cough a lot more at night than you do during the day, so you sort of get a bit disrupted in your sleep and you're thinking, oh, this is a bit annoying, and in the middle of the night you might think, I'm going to go to the doctor, but the next morning you wake up and you don't actually feel sick. And how many of us go to the doctor when we don't actually feel that sick?
Yeah.
And so we can't treat whooping cough, and that's one of the biggest challenges, and one of the reasons why we vaccinate against it is because there's no treatment. We can provide supportive cares and we can help look after the people who have got it, but we actually can't give them anything to make the disease process less.
So they've got to work through the process.
They've got to work through it.
Yeah.
So it's whooping cough is particularly challenging. It's also a disease that does not provide lifetime protection. So you can get whooping cough more than once.
Yeah. So for any of you out there that are expecting any grandchildren, or you're around children regularly in your occupations, or you know, with whānau, that's a really good idea to check your immunisation status and think, oh, maybe I should go and get it done. And
that's part of that whole theme about being protected together. It's about our opportunity to protect those who are vulnerable as well.
So when you hear about herd immunity, what does that mean?
Herd immunity, or probably it's slightly nicer referred to as community immunity these days. But that's around the idea that for most diseases, if we can get the large majority of people vaccinated, the disease itself won't have space to move. It won't have space to spread. So something like measles, which is very topical at the moment, we actually need 95% of people to be immune for us to actually effectively stop measles in its tracks. And that really does mean that 95% of people need to have their vaccinations, or more would be great.
Yeah.
But there are always some people who can't be vaccinated, whether that's, you know, usually for medical reasons, or they might be on a particular medication. So there are reasons why some people can't be vaccinated, and it's not always their choice.
And it's about protecting them like it is protecting. Yeah. So anyone who's not immunised at the moment, or hasn't got the ability to be immunised yet for, say, measles, is is a vulnerable population.
Yes. Yeah. And we'd like to keep that vulnerable population as small as possible.
And so we can take our own responsibility as adults to make sure that our immunisation status is good, so that we're not posing those in the community, like our little ones, and those who are either on medication or that have an illness that makes them compromised from an immune perspective, and we can protect them that way.
We can certainly help protect them that way. Yes.
So we've had some questions. So we've got about, I've got a 1-year-old. Can I have their 15-month jabs early?
Okay, so I think Christchurch is still in a state of trying to keep measles out, and certainly in general, if a parent presented early requesting their child who is over the age of 12 months have their vaccines early, in most cases that would be happily done. Right. And certainly if that is the case, and if a child is having particularly the MMR given early, we would actually recommend all of the 15-month IMs are given early.
Yeah, that way they will make sure that they're done, rather than partially done and then something gets left off.
Yeah, and then also, I mean, children do start to remember. If you have to bring that child back again, they may recall having come here and had an injection and I didn't like that much, and be more difficult to deal with. Yeah. So yes, certainly, talk to your general practice about having it done early if that's something you feel is important for you.
And your practice nurse is a really good first port of call.
Absolutely.
Yeah. And how old is it before my child can have the flu injection?
Okay, so with flu vaccine, it's licensed from 6 months of age, so that would be generally the earliest. If you've had your flu vaccine during pregnancy, that does provide some protection for infants in those first few months. And 6 months is the licensure date. So that's the date that it's regulated for to be able to give it. Yeah.
And it's not funded on the immunisation schedule currently?
Not for all children, no. There are some children who do qualify. So if they've got particular chronic medical conditions, or if the child under the age of 4 has had an admission to hospital for a significant respiratory illness, or their health team feel that they have had a particular significant respiratory infection in the past.
Right.
So that's just for children under 4 and under.
And we've had another question about the 15-month immunisations.
Oh, it's
and
a popular event.
Oh, it is. Well, it's quite a big event because the first 3 have been done when they're babies at 6 weeks, 3 months and 5 months. But now that little person is a little bit more aware, and they're maybe a little bit more challenging to manage their distress, maybe, you know. Yeah. So, you know, what are the side effects that one might expect?
Okay, so with all immunisations, in general, what we expect is that there'll be tenderness at the injection site, might be a little bit red, might feel a bit uncomfortable. Cold flannel is great for dealing with that. In a number of cases, it's common for children to have a mild fever. Now that's a sign of an immune response. You know, the body's getting underway, it's recognising that there's a foreign protein there, and it's setting up an immune response. So fever is a normal response, and that again can be managed with, you know, a cold flannel, taking clothing off, frequent feeds.
Yeah.
In particular with the 15-month event, you can find that children get a rash about 6 to 12 days later. Now that rash isn't infectious, it's just a normal part of the process, particularly around the MMR vaccine. And for some children, they also can get a chickenpox-like rash as well. Now that rash will look like chickenpox. It will have the fluid in the vesicles and the blisters, and that may potentially contain vaccine virus. So that's something that should just be covered and just. So
if they came up with more than one spot, they should cover them with like a band-aid?
Well, clothing is absolutely fine.
Clothing is fine.
Yeah.
Right.
So, and it's not common.
Right.
But you do hear of it from time to time.
Yeah, I think sometimes parents get concerned when their babies come out with a rash after immunisation. As you would, any rash always should be assessed by, you know, in the first instance, a nurse maybe, by ringing one of the 800 numbers, or by going and seeing your doctor if you're really concerned.
If you're really concerned.
But we'll always help you at PlunketLine, and of course 0800 Immune are there to help you with, you know, any of your questions.
Yeah, definitely. If you've got questions about side effects or concerns, then, you know, certainly feel free to give us a call at 0800 Immune.
Yeah. So look, we're going to come back, you know, in our second segment at about 20 past. We're going to look at sort of, you know, what the immunisation schedule looks like, you know, when they're given and why they're given. What are the common, you know, questions that people have, you know, when taking a child for an immunisation? And so some practical tips, we'll go over those about, you know, before and after the immunisation as a parent, how you can help your child through that.
Cool.
Okay. So see you back at about 20 past. Thanks.
Thank you.